Well, hello, and thank you so much for joining us this evening for our 2023 Community Health Education Series. My name is Zavanya Covington, and I am the Community Partnership Coordinator for Faith-Based Partnerships and Senior Strategies in the Social Responsibility Department here at Baptist Health. So April is recognized as Minority Health Month. So our topic tonight is Minority Women's Health. So we have a very special guest speaker tonight who I'll be introducing in just a moment. But first, as always, we like to review a few housekeeping items in the agenda. So again, we will review a few housekeeping items. I will introduce the speaker. We will have Q&A, and then finally, we will have some closing announcements. So as far as our housekeeping items, we are recording tonight's session. So this recording will be given to or sent to all of our registrants tonight. As well as if you're attending and you did not have a chance to register and you're maybe viewing with someone else, we first say thank you so much for joining us and thank the person who introduced you to our health education series and invited you tonight. And so we just asked, if you will, just place your name in the chat so that we can have that for our records, have your attendance for our records. And then finally, we will be monitoring the chat. So please, 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 place your questions there during the presentation, and we will allow those questions to be asked to our special guest speaker at that time. I just want to let you know we have a very special guest speaker today, and so we want you to ask your questions and please don't be shy. And so without further ado, we have Dr. Trishella Johnson-Foy. So Dr. Foy is an experienced board certified family physician with more than a decade of experience who focuses on compassionate, patient-centered care. Dr. Foy completed her residency at the Mayo Clinic, Jacksonville, and is a trained diabetes master clinician with expertise in most chronic disease conditions. Dr. Foy chose to be a family physician out of a desire to provide continual life care to patients and their families. She believes that focusing on wellness and prevention is essential to truly caring for our community. Dr. Foy, thank you so much for being here today. Thank you for just always being there when we call. You never say no. I don't know how you find the time of the day, but we so appreciate you being here today because we know you're just so passionate about serving our community in the way that you do so wonderfully. So thank you so much for being here. And I'm going to stop sharing my screen so you can go ahead and share yours.
Thank you for allowing me to be here. It is, always an honor to be able to speak with the community, to be a part of this great efforts that you guys are doing, making sure that our community is educated in the proper way. So I am quite thankful to just be a part of it. I appreciate it. We got the screen sharing on, right?
Yes, I can see it just fine.
All right, awesome. So, ready for me to jump in?
Yes, please, go ahead.
Well, hi, audience. I, once again, am Dr. Trishella Johnson-Foy and feel honored, as always, to be able to come to you to talk about something that is, of course, important to me because this is about Black women's health. So I kind of titled this Long Live the Queen because it is important for us to really learn about ways to promote longevity in women of color. And so because of that, this is kind of near and dear to my heart today. And so I don't have any disclosures other than the fact that I am a Black woman. Otherwise, no concerns about any conflicts of interest. So why are we talking about this? Why is it important to have conversations about our health in general? We all want to live as long as we can. We want to see our children and our grandchildren and great-grands if we have the opportunity to. And so that translates into our years of life. And the CDC found that Americans are expected to live about 78.7 years, but women are more likely to outlive men by about 5 years nationwide, according to the report. Now, when you look down across our great nation, you can see the darker areas are where people live the longest, and some of those lighter areas are where you don't see as much longevity. And these areas tend to be areas that are concentrated with minorities, with African American women and men. Now, if you look at our great state of Florida, you will see that we actually do still have some longevity left. Now, that might be because as people get older, they move to Florida. So you will see a lot of older patients or older communities in Florida, but that says a lot about where we are. So I'm excited to be here. Now, as we look across, normally, although women live longer than men, sometimes you have moments where Black women have just really stood out. And back in 2016, even though there were some slight declines in life expectancy for other populations, white men, white women, Black men, Hispanic women, Black women defied that trend, and we actually showed an increase in life expectancy in 2016. Now, I don't know if it's because our First Lady was great and she was gardening and teaching us how to move and really take care of ourselves, but that was an awesome time. Now, since that time, things have changed a little bit. We, of course, have been plagued by the great COVID pandemic. And so when you look at this map, you see, or at this graph, you can see that life expectancy for men and women have taken a dip over the last few years. A big part of that, of course, was due to COVID, where it claimed the lives of many young people and older people. Many people died, and African Americans were disproportionately affected by deaths from COVID. So this dip that we've seen over the last couple of years is something that we want to reverse. We want to have this trend start going in the opposite direction, just like we were back in 2016, where people were thriving and living long lives. So the Black woman has long been considered kind of the epitome of strength, to the point where sometimes it is done in a way where our health is not taken as seriously or may even be neglected. So my goal today is to teach you how to embrace who you are, to understand the things that are important for you to have a long and healthy life. What types of things can help keep you from getting sick? How do you thrive? How do you see these years go beyond even what our chart says, where people on average are living to be 77, 81? We want to see our hundreds. So how do we get there? Before you can make effective change, you got to know what the problem is. What are the biggest threats to our health? What are we dying from? So this map, and although it's 2018, it's a reflection of what is most current. Heart disease, and most women at this point know that heart disease is the leading cause of death for women. Now, 10 years ago, when this question would be asked, only a few people in the room would know this. But thanks to a lot of marketing and push to help really decrease heart disease, this has been known, this is now known that most women, and Black women especially, die from heart disease. Cancer, and that's all different types of cancers, and we'll talk a little bit more in a second about that breakdown, is the second leading cause, and strokes are the third leading cause. Now, I will tell you, when we look at heart disease and strokes, we all oftentimes put those together, and we consider that cardiovascular disease. And so anytime those arteries are being affected and blood isn't flowing to our organs the way it's supposed to, this is this cardiovascular syndrome. So when you put those together, that's almost 30% of Black women, the cause of death for Black women. Diabetes comes in next at 4.5%. And then you have things like Alzheimer's disease, where it's something that we don't get to talk as much about, but they're making a lot of inroads and doing a lot of research into this disease and how it affects people in general, but definitely the Black community. Unintentional injuries, chronic lower respiratory disease like asthma and COPD, chronic kidney disease, septicemia, and then hypertension is coming in at number 10. Now, the thing to know about hypertension, although it's suggesting that it is number 10, it actually plays a huge role in that number one cause. So that number one cause and hypertension go hand in hand. So it's a little bit misleading to see it at the rounding out the bottom of the list. And we'll talk a little bit more about that shortly. Now, what also matters, I just talked to you about the top 10 causes of death of all Black women, but it actually varies by age. The group you in, your current cohort, what your top threat is differs. And so when we look at young women, children, of course, young 1 to 19 years old, you're talking about things like injuries, accidents, homicide, suicide, and birth defects. And unfortunately, yes, you do have some children who die of cancer, but this is a lot less. As you move into that 20 to 44-year-old age range, these are still young people. And so Black women who are in that age range are still most often, the cause of death is unintentional injuries, accidents. Cancer still rolls in at number 2, but then heart disease starts creeping in there, even as women are only in their 20 to 40-year-old age range. Homicide and diabetes round out 4 and 5. But number 6 is something that I felt like I would be remiss if I didn't really take a moment to talk about that. Pregnancy complications is the number 6 cause of death for young, healthy women who are in those fertile ages. That 2.9% risk, though, are 2.9% of the population who die from pregnancy complications, doesn't really truly paint the picture of the health disparities and the maternal mortality rate that affects Black women in comparison to others. And I'm going to take a moment in a second to really discuss that. But I'll move us forward a little bit in this age group, just so you're clear on what your personal risk and depending on what age you are is. So 45 to 64, we're still talking about now cancer being more of the number 1 cause of death for Black women. Heart disease, though, is creeping up. You have 29% who die from cancer, but then to about 21 to 22% that are now dying from heart disease. Accidents are falling down because people are now starting to have actual more health issues. Diabetes and strokes rounds out that age from 45 to 64. Now we move into our 65-year-olds. People have retired and are trying to just live their life. And that's when things like cancers really are still starting to jump in. But I've told you that the number 1 cause of death are the causes of death as you are getting older is heart disease. So you're looking at a very close race between heart disease and cancer. When you put heart disease and stroke, which is that cardiovascular disease, then it does beat out just cancers alone and diabetes, and then things like COPD and asthma. 85 years and older, heart disease is number 1. And if we're blessed enough to live that long, then it will be heart disease that usually is going to be the primary reason we pass away. So we talked about that. Now, how do you prevent these things? How do we take what we know about what our biggest threats are and learn from them? Well, I first want to highlight this maternal mortality risk. When we look at what's going on with Black mothers versus white mothers and Hispanic mothers, Black women face a 3 times higher maternal mortality risk. So if you have daughters or nieces who are in these childbearing years, make sure that they're taking care of themselves. Make sure that you're advocates for them when they're in the hospital. Stand by them, be there with them, make sure the doctors listen, because it is not acceptable that this type of divide and disparity exists. It is not dependent upon income. It is not dependent upon education completely. It is some other built-in systemic racism that has existed in our healthcare system for a long time that fortunately we're trying to dismantle. The AMA came out and admitted that systemic racism in medicine exists, and that they were the carriers of it. They carried the charge a long time ago. And so now these are the results of this. So we're losing our mothers, we're losing our babies at these young ages, and it is not acceptable. And the unfortunate part is, as we look at this, this isn't something that's an old slide that is relating to things that were of yesteryear. This is what's happening now. And this divide in maternal mortality rate continues to increase. So we have got to do something different to make sure that our mothers are protected, our young women are here to care for their children and love their children, and that they're not dying during childbirth. So I wanted to make sure we took a moment to talk about that. It's not always about heart disease. Now, right now, we're going to take a minute to talk about cancer. And cancer, we stated, is the #2 cause of death in women, as Black women, as we age. But what types of cancer? So when you break down what types of cancers we are looking at, breast cancer has now surpassed lung cancer as the #1 cause of death in Black women. Now, this here is a representation of all women. So you have lung cancer, breast cancer, colon cancer, uterine cancer, and melanoma as the most prevalent causes of cancer. But the most prevalent cause of cancer death is the lung cancer, breast cancer, and colon cancer, always rounding out those top 3. And then pancreatic and ovarian cancer. Although they're a lot more rare, they are very malignant, and people don't survive long from those. So breast cancer, and this is what I spoke on earlier, it has surpassed lung cancer as the leading cause of cancer death among Black women in the United States. So we have to make sure that we're doing things to kind of change this statistic. We want to make sure that we are taking care of ourselves, getting the things we need to not be the statistic that is being shown now. So screenings are going to be key. There's a lot of confusion about when to get a mammogram, who needs a mammogram. So the American Cancer Society has recommendations. The United States Preventative Service Task Force has recommendations. ACOG, which is the American College of Gynecology, has recommendations. But when we kind of boil it down, this is what you should know. Women between 40 and 44 have the option to start screening with a mammogram every year. I will tell you, because Black women die disproportionately more often from breast cancer than any other race, I start doing yearly screenings at 40. It's a conversation that I have with my patients, but I do encourage it. What the recommendations are, definitely at 45 to 54, every year you should be getting a mammogram because this is your highest risk time frame. Women over 55, the recommendation suggests that you can actually switch to every other year, or you can continue yearly. I encourage my women to continue their yearly mammograms. It's covered, it's quick, it's something that can really curtail the progression to cancer. The earlier we can detect things, the better. So I honestly try to encourage every woman to just stay on that yearly track if they can, if their health allows. All women should understand what to expect when getting a mammogram for breast screening. The test does not treat cancer, nor does it cause cancer. I get those questions a lot, more so about causing cancer. And so there's a lot of bad information. There's a lot of things about radiation and exposure. There is very minimal radiation exposure from mammograms. Also, mammograms have been shown time and time again to be very safe and effective in doing what we want it to do, which is to detect breast cancer. Now, it's not 100%, so you want to make sure that you're having good conversations with your doctor. I will tell you that in the past, we always stated, make sure you're checking your breast at least once a week, once a month. And that is no longer the recommendation in the sense of what the societies have suggested. And the reason is because there were a lot of women who were not sure what they were feeling and just got confused and scared. It led to a lot of biopsies that were normal. And so a lot of the mental strain that came with it is the reason why, when you looked at the benefits of doing self-breast examination versus the potential harm, which everything has a potential for harm, it was determined that we should make sure you're getting your mammograms, have your clinical breast exams done by your doctor, and it gives you less worry. Now, if you know you have a strong family history of breast cancer, you still want to definitely pay attention. You pay attention to your body. If it feels tight, if it feels heavy, if it feels lumpy, those are reasons that you definitely want to contact your physician right away and be seen right away. Okay. Now, colon cancer. Colon cancer is something that is also very preventable. We start screenings now at the age of 45. Not long ago, it was 50 years old. And then they adjusted it to African Americans being suggested to be screened at 45. But now the recommendation is for everyone. I cannot begin to tell you how many young people I am seeing with colon cancer. I had a patient last night who I sent for her screening colonoscopy, and sure enough, she ended up having colon cancer and just had surgery to get it out. The thing about going in and catching it early is that you can treat colon cancer right then. Sometimes that polyp is just growing and you can have it taken out and removed, and sometimes that's the whole cancer. If you are fearful about having a colonoscopy, then there are other tests. Colonoscopy for people who have no problems is once every 10 years. If there are polyps, it depends on the type of polyps, and we do it every 1 to 3 to 5 years to make sure we're looking for things early. Cologuard is a stool test that is good for 3 years. It's very easy. The company is great about sending it to your home and making it easy for you to take your sample and send it back. The FIT test is good for 1 year. Some people don't mind doing a FIT test yearly if they can avoid a colonoscopy. Now, if the Cologuard or FIT tests are positive, then you will still need to have a colonoscopy. And the colonoscopy on average takes about 6 to 8 minutes to do. The worst part of it is the laxative that you take the day before, and it is usually the best nap you ever had. As a matter of fact, and this might be telling too much, but my husband had his this morning and he was a-okay. So again, you want to make sure 45 is when you start. So young women, make sure you're talking to your doctor about having it done. If you are in good health, then you should get regular screenings at least to the age of 75, definitely is a recommendation. For those who are 76 to 85, then you talk to your doctor about what your health looks like. If your life expectancy is thought to be more than 10 years, then yes, we still do colonoscopies. So 85 is kind of the cutoff for a gastroenterologist for screening colonoscopies. Now, people, if there's something going on, if they have blood in their stool or they're bleeding or anemic, then yes, they still get a colonoscopy. It may be warranted, but in the general sense, the colon screenings stop at around 85. Now, cervical cancer. Although cervical cancer was not at the top of our list anymore, there's a reason why. It used to be the #1 cause of cancer deaths in women, but fortunately, the Pap smear was invented. And now there are changes to how often you need a Pap smear. So when I first started training and was in medical school, everybody got a Pap smear every year or was supposed to. If a young woman became sexually active, then she was going to get a Pap smear. We now don't start doing that until they're over 21 years old. And then we do it once every 3 years if they have no significant changes on their Pap smears. Once you hit age 30 to 65, the recommendations are actually every 5 years if you have the Pap smear and an HPV co-test. HPV is the human papillomavirus, and this is what leads to cervical cancer. There are over 100 different types of HPV, but there are 16 high-risk ones that have been shown to be associated with cervical cancer risk. And of those 16, there are 2 that cause about 70% of cervical cancer. So being tested for this, if it is negative, then the likelihood of developing cervical cancer is very low. I know that you will talk to someone like me or other doctors who haven't completely gotten comfortable with the idea of seeing people every 5 years. I, at this point, have good conversations with my patients about what is right for them, and we follow the guidelines that way. It took me a minute to get to 3 years, but I do follow those recommendations and guidelines that every 3 years is a reasonable time in someone who has not had an abnormal Pap smear and does not have a strong family history or a high risk. The best thing about cervical cancer, second to the Pap smear development, is the development of the HPV vaccine. So we are now in a space where if we vaccine properly, we could actually eliminate an actual cancer. This shot actually prevents cancers. 90% of HPV cancers can be prevented by proper vaccination. It can prevent at least 6 types of cancer, not just cervical cancer. And it's recommended in both young men and young women, or boys and girls. 4 out of 5 people will get HPV in their lives. So that means if you have 5 friends, 4 of you have had HPV. If this HPV can cause cancer, then you want to be treated and prevent and help prevent this. So encouraging young people, encouraging parents to make sure that their boys and girls are vaccinated at the proper age. That age is starting at the age of 9. And initially when it was released, it was approved from 9 to 26. It is now approved from age 9 to 45. and the insurance pays for it because it is preventative, and it's something that is an excellent way to prevent cancer. Uterine and ovarian cancer screening is a little bit more complex. There are no actual screening tests for uterine cancer in women who don't have symptoms. So that means if you're feeling fine and not having pelvic pain or excessive bleeding, then we're not really screening for uterine cancer, which is why it becomes important to pay attention to your body. A pap smear checks for cervical cancer. It is not a screening test recommended for uterine cancer. There are other things that we do that allow us to detect uterine cancer. Ovarian cancer screening also is not recommended in women who are of standard or average risk or women who are of low risk. If a woman is high risk, meaning she has a family member who has ovarian cancer, and it's usually considered a direct relative, then we are able to use a tumor marker called CA-125, which is a simple blood test that we can do that we usually use it in managing ovarian cancer and seeing how well treatments are working. But on occasion, it can be used as a part of a screening in high-risk families, women who have a family history of ovarian cancer. And then also the pelvic ultrasound, which is going to be the best way of being able to see if something is growing inside the pelvis. So talking to your doctor about your risk becomes key and important. Lung cancer screening. Another development that has come over the last in the last decade is lung cancer screening, where the insurances are paying for it, and we have been able to dramatically decrease the number of deaths from lung cancer. People who are at risk are people who have been long-term smokers, and meaning they have more than a 20-pack year smoking history. 20-pack year doesn't mean that you smoke for 20 years all the time. So if you're someone who smoked for 10 years and you smoke 2 packs a day, well, if you quit 5 years ago and you're over the age of 50, it's going to be recommended that you have this CAT scan, which is a very low dose CAT scan, to look for lung cancers. I have found several lung cancers in patients with this simple screening test. And because of it, it was found very early, stage 1 most of the time. And so making sure you talk to your doctor about having this lung cancer screening at least once a year if you are between the ages of 50 to 80 and you have a 20-pack year smoking history, and the last cigarette you had was within the last 15 years. Once you get past those 15 years, then there is less risk and less concern. So we tend to not it is not recommended at this time to do continued screening once a patient is 15 years beyond their smoking history. And then finally, cardiovascular disease. So I know you guys get a lot of information about heart disease. And so I wanted to make sure today I spent time talking about the other things, the preventative things. The devil was also kind of busy and messed up part of my presentation. But luckily, because cardiovascular disease is the #1 cause of death in our country across all races, it is something that I feel very well versed to talk about. So when it comes to cardiovascular disease or heart attacks and strokes, we know that there are certain things that put you at risk: high blood pressure, diabetes, high cholesterol, smoking, and family history. Those are the biggest things that put you at risk for cardiovascular disease. Now, in our body, heart disease actually starts when we are born. You start building up plaque in those arteries from the time you're born. They did autopsies on 19-year-olds a long time ago and saw that those 19-year-olds actually were already developing this plaque in their arteries that was leading to blockages. These blockages that occur end up causing patients, these blockages that occur end up over time leading to inflammation. So it's not just the blockage itself, it is these inflamed areas that comes from high blood pressure and diabetes and smoking that end up allowing what's called a little plaque to erode. And that's how people typically will have heart attacks and strokes. So what are the risk factors? I told you the big five, but guess what? There are over 250 risk factors for heart disease, and it's all about inflammation. Even when you have inflammation in your teeth and gum line, this is a risk factor for heart disease. So you want to make sure that you are keeping your body as healthy as possible. Plant-based nutrition, so eating lots of fruits and vegetables and grains, that is what's going to allow you to be at your most heart healthy. When we look at nutrition and what nutrition plan, because people are always asking me about, well, what diet should I do? And I always try to remind people, it's not about diet. I want you to really think of what should your lifestyle, nutritional lifestyle be, where it becomes second nature. It's not, there's no pressure with it. You're making good food choices. What should that be? Well, the most heart healthy nutritional plan is the Mediterranean diet. So the Mediterranean diet is chocolate, lots of fish and healthy seafood, things like salmon, tuna, mackerel, herring, things that have good healthy fats in them, as well as lots of, they cook with oils like olive oil and avocado oil, things that are high in omega-3. They still have a lot of plant-based nutrition where most of their nutritional intake is still the greens and the veggies and the grains and beans, and not as much meat. But they do eat meat as well as a part of this nutritional plan, but they limit it to 2 to 3 ounces only a couple times a week, if at all. So you don't have to feel like you're starving yourself or that you are completely depriving yourself to have a healthy heart, a healthy, strong heart. Now, there are certain things that you're not going to be able to change when it comes to your risk of heart disease. The older you get, the higher your risk. If you are certain ethnicities, African Americans are at higher risk. And then if there's a strong family history, those are what we call the non-modifiable things, are non-modifiable risk factors. Those other risk factors that you do have some control of, how much you smoke, how well you take care of your blood pressure, how well you manage your sugar and your cholesterol, how much you move. If you have a sedentary lifestyle, then you are more likely to have heart disease. So numbers you should know. You should know your BMI, which is your body mass index. That's your height versus your weight. You should know how many, you should know what your range should be. And the range should be less than 25% to be considered healthy. Anything over 30% is considered obese, and anything over 40% is considered morbid obesity. The reason why it's called morbid obesity, people, are very sensitive and they're like, I am not morbidly obese. And the word morbid is about things that can cause death to you. So the heavier you are, the higher the potential for you to be at risk for cancers and strokes and heart disease. So that's why it's called morbid obesity. So the goal is to move out of that direction, but you don't have to jump from 40% down to 25%. Just taking 5% of your body weight down helps to greatly decrease your risk of conditions that lead to heart disease and heart disease itself. You should be knowing you should know what your blood pressure is ranging. The goal ideally is really for it to definitely be less than 130/80 consistently. And the lower, the better. I had a patient today who said, oh, my blood pressure is just too low, that top number is 120 and my body's just not used to that. And I explained that, no, this is where you want to be because you already have kidney damage and heart damage. So we want these numbers to be as low as possible, as long as you're not feeling dizzy and tired. If that is the case, then that means you need to talk to your doctor about maybe changing your medications. Smoking, of course, you should not be smoking. There are over 14,000 chemicals and I might have exaggerated that a little bit. There are definitely, my last check was over 1,400 chemicals in cigarettes. So smoking is one of those things that I don't have to spend a lot of time telling you that you know that smoking is bad for you. You want to make sure that you are only putting healthy things in your body, that you are making good decisions, that you're keeping your blood pressure controlled, keeping your blood sugar controlled. So let's talk about blood sugar. So when you go to the doctor, your fasting sugar should be less than 100. If it is over 100, that means that you are likely in what's called the pre-diabetic range. Pre-diabetes greatly increases your chance of having diabetes, which increases your risk of heart disease. So much that you have a 3 to 5 higher chance of having and dying from a heart attack or stroke. So knowing what your sugar numbers are extremely important. Things that promote diabetes is the stuff that we eat when our body can't control sugar in the best way: pasta, potatoes, bread, rice, grits. In the general sense, if your body can handle them, they're not bad foods. But if you know that your body is not capable of tolerating and breaking that down in a proper way because your doctor has told you you have prediabetes, then you want to minimize using or eating and indulging in that. So really making sure you know what your sugar numbers are. Your cholesterol. There are 3 numbers that are important in the cholesterol, and your total isn't one of them. Your good cholesterol, which is called the HDL, is the high density lipoprotein. That's because it is made more of protein, so it helps to clean out our arteries and decrease inflammation. Whereas the low density proteins are made mostly of fat, and this is your bad cholesterol. So we want the low or lousy cholesterol to be low. So we want that number to be less than 100. It depends on how old you are and your other risk factors. So you'd really want to talk to your doctor about that. The good cholesterol in Black women, we want it to be greater than 50. And that is where you start getting heart protection. So you want to make sure you are doing things that help to promote those good cholesterol. And then your fat levels, which are the triglycerides, that is one that is more related to how you're eating. And so plant-based nutrition, focusing more on fruits and veggies and grains will help keep the fat levels down. Right. When you go see your doctor and you're talking about your potential risk of heart disease, then you want to ask them if you're over 40 to do a cardiovascular risk score. This tells you what is the likelihood of you having a heart attack or stroke over the next 10 years. And it's an easy number to calculate. We keep it on our phone, or we can pull it up on a computer real quick. Those are the things that will help you know how to guide your health, how to make sure that the things that you are doing are going to ultimately improve longevity. Everything that I've talked about, prevention is the key. The things that you do now, the things that we are discussing and talking about, take heed to what I'm saying. Listen to the things that you can control. Listen to the things that you can guide. You determine how much you move. You determine what food goes in your mouth. And by making sure you're intentional about your health, you can improve the likelihood of you living a long and healthy life. So I think that I want to make sure we leave room for questions. So looking at the time, how am I doing on time?
You're actually doing great. We did have one question, but if there is more that you would like to share, I would definitely want to give you some more time to do that, and we can, fit in a few questions at the end.
Okay.
So is there something else that you want to share? You have a few more minutes to share.
Yes.
Yes,
So,
please go ahead. Yeah, because
yes.
we
So,
definitely want to hear all that you have to share.
yes. So as we look at, and I told you guys that part of my presentation got cut off, so I don't want to just overwhelm you with my voice. So I do want you to come with your great questions, so that I can provide some answers and interact for you. But when it comes to Black women's health, and when it comes to making sure that we live long, healthy lives, our mental health is key. We have something that's called superwoman syndrome sometimes, where we are constantly taking care of everyone else, and we don't do the things we need to do to love and take care of ourselves. So making sure you have moments and take moments where you are doing the things that rejuvenate you, that restore you, whether it's something as simple as taking a bath, lighting some candles, reading a book, taking a walk outside. Make sure that you are doing things that are going to restore you. If not, then our body on the inside gets damaged just from us not taking care of ourselves in that mental and spiritual planes in our life. When we look around the world, and you guys have heard us talk about blue zones in the past, and blue zones are these communities around the world where people live to be over 100 and are very healthy and vibrant and are thriving. Some of the things that for them that they do is incorporate the importance of mental health, the importance of community. So when I say community, it doesn't have to be, oh, just in my neighborhood, or I'm going to only engage with. You want to make sure that you have built a community around you, people who are loving you, people who you can love, because that helps promote longevity. Making sure you live with a sense of purpose, finding something that you can tap into and believe in and be guided by, and that it gives you life to wake up every morning. That sense of purpose is what helps to keep us here for longer, healthier lives, whether it's our children, whether it's a project, whatever it is, make sure you live it with great passion. Fellowship. So fellowship, of course, the first thing we think of is church, and that has been shown to be key. Having a strong spiritual foundation, a strong spiritual, a strong spiritual foundation, and fellowshipping with like-minded people is something that also promotes health and longevity. So I encourage that as well. And there are many things that kind of are a part of the blue zone state of living. And in Jacksonville, when you hear about the Blue Zones Project, we're trying to undo some of the bad habits we have and the things that we have done poorly. But I want you guys to focus on the things that you can do well that help promote longevity in you. So I do want to thank you again for letting me speak, and we can start taking questions now.
I told you all were in for a treat. Thank you so much, Dr. Foy. Your passion just shines through. So thank you so much for such an awesome presentation. And we do have some questions. I had some questions on my own, and you really addressed it with the mental health. I did have a few more, but I want to answer some questions from our attendees first. So Miss Stephanie Gillum Brown, she asked, is a CAT scan recommended if you live with a 20-pack smoker?
So secondhand smoke has definitely been shown to increase your risk of heart disease. Unfortunately, we're not at a place where the insurance counts that they look at it as it has to be your own personal risk. But it is something that, because scientifically we know that if you live in a household, whether it's your parents or your spouse, that it increases your risk of lung cancer. We're working on trying to have them expand the screening to exposure. And but right now it is direct exposure.
Okay, well, thank you so much for that. Ms. Gillen Brown actually has another question. Do you recommend the new full body scans?
So the problem that occurs when we take a full picture of things is that a lot of times you find things that have no incident, no meaning, they're not going to cause you any problems. They're not really something that is worrisome. And so blanket screening is not something that is recommended. Now, when it comes to trying to determine your cardiovascular risk, there was a screening test that I did not mention, and it's called a cardiovascular a CT calcium score, which is a CAT scan that looks at the arteries to your heart and the blood vessels. And it allows an opportunity to quantify what is the likelihood of you having a heart attack or a stroke. It actually is a very inexpensive test. So I encourage people to put their treasures in things that are going to give them something back. If you do a full body scan, if I lined up 100 people and I did a scan, at least 50% of them are going to have a cyst on their kidney that is of no consequence. But if I tell them that, they're going to have palpitations and drive themselves insane. So just blanket scans is not useful. It actually can be more harmful just with the mental strain that it can cause. So this is why we take the time to tell you what are the screening recommendations, what are things that you should focus your attention on. And so, for instance, one that's a very controversial now, this was a talk about women's health, so I did not walk down that road, but a PSA, which is a test for screening prostate cancer in men. Well, the recommendation at this point is that perhaps we don't need to screen every man with a PSA. And there's lots of reasons for that. And primarily because they don't typically die from it. They don't typically have harm from it. But if we screen everyone and it says, hey, there's a little bit of prostate cancer in there, and now we're putting them on chemo, and we actually can potentially decrease their life expectancy, decrease their quality of life. And so you want to be mindful about how you are monitoring and screening things. And so I hope that answered your question. When you have someone come and they say, hey, we can do a screening of your carotids and your thyroid and the arteries to your legs, those are actually meaningful tests. So if it's something that's very deliberate, you always want to know, what is this going to answer? But if it's just taking a picture, it's not giving you much.
Gotcha. Thank you.
You're welcome.
And then there's another question. How do you increase your HDL number?
Okay, so increasing HDL can be a challenge. Probably about 15 years ago, there was this medicine, and they're still researching it, that we thought was about to be this fabulous way that just increases people's HDL. And then they got to the last stages of testing it, and it was causing great harm. So it did not make it to market. And there have been about 2 or 3 of those. And so your body actually makes cholesterol. Most of when we measure your numbers, comes from what you have been genetically predisposed to make. So some people actually are going to make a lot, and some people are going to make a little. If you are a smoker, one of the things that we know for sure is smokers cause their HDL to be lower. So not smoking is one of the #1 ways of increasing your good cholesterol. Exercise can help to increase your good cholesterol. And when we talk about our nightly beverages.
Mm.
A little bit of alcohol actually helps to increase your good cholesterol. It's one of those things. A lot of times I'm reviewing people's labs and I'll come across a HDL that's like 95. And I'm like, so what type of cocktail do you have in the evening? Maybe like, I have a highball. And so my little old ladies, that's what's keeping their good cholesterol up sometimes. So alcohol in moderation actually has health benefits. And it's not just red wine. There's actually most alcohol have health benefits. And it's one of those things that's very easy to look up because they're mostly made from grains and fruits and berries. And so that is why you actually have health benefits associated with most of them. And so, and a part of the benefit is measurable when I am checking their good cholesterol. And it's not just anecdotal. We know that there's definitely heart health benefits, and that's one of the ways that it manifests.
Okay. Thank you so much for that. And then Mr. Willie Merrick, he was asking about how can he get more information about Blue Zones, specifically the Jacksonville Initiative? Well, I can answer to that. I know that you can too. June 3rd is actually our Blue Zones Jacksonville kickoff event. Saturday, June 3rd, that's actually going to be at the Jacksonville Fairgrounds. And so I will be sending the flyer for that. With the information that I will be sending to all of you all tomorrow so that you all can look that up. And please, please, please make time to attend. It's going to be a great event for the entire family. So I didn't know if you wanted to also speak on that as well.
Yes. The other things that you can do in the meantime is they have a fabulous website. There's
Yes.
a book. They have a Blue Zones recipe book that actually kind of tells you the story of Blue Zones while at the same time giving you these fantastic recipes that are more plant-based and more heart healthy that you're able to incorporate into your lifestyle and incorporate into your health. But it's a very, you'd be amazed at the simple things that have guided these communities. We have one in the United States, it's Loma Linda, California. But we're trying to make it something that, you know, everybody is aware of. I actually, where I have a medical conference coming up. And so they were saying, well, get some topics. And I was like, well, why don't we do a Blue Zone sessions? Because I want every doctor to know about Blue Zones, not just for their communities, but for themselves. You know, we take care of people. We need to be around a long time. But if we are responsible for healing communities or helping to prevent disease in communities, then you need to know where people are living longer and healthier lives. What are they doing? We need to know these things. So I encourage it.
Great. Yeah, that's some great information. And yes, you could actually also sign up for the Blue Zones newsletter from the website. So I definitely will be providing that information for everyone. So thank you so much, Dr. Foy, as always, for such a wonderful presentation. I did have a few closing notes. I know we're at the 7 o'clock mark, but if you will please allow me just 2 minutes to share with you some closing announcements. So there will be an electronic takeaway that will be emailed to all of the participants or the attendees tonight. I just placed the survey link in the chat. Ask that you please take a moment to complete that survey. That really helps us to guide the health sessions and the information that we bring to you each and every month. And next month, we will have our next session, and our topic will be exercise is medicine. Let's get physical. So we will have Connie Smith, who's the director of community integrated health programs from the YMCA of Florida's First Coast. So she will be here with us next month to talk about exercise. And then if you just want to make a note of the future sessions that we have already scheduled, June 20th, we will be talking about living a brain healthy lifestyle. And in July, we'll be talking about arthritis and bone health. So thank you so much again, as always, for joining us. for our health sessions. Thank you for joining us tonight. That ends tonight's session, and we hope you have a wonderful evening.